It goes mostly we consider women, because women like sugary things like sweets, dizzy. Most of the women, because there, as I say, there is also frequent vaginal yeast infection. What does that bring? It brings this excessive sugars, vaginal yeast infections. Each and every time you see the women going to the clinic have infection. What brings that infection? Excessive. Samuel Omondi. Here I work in Mani Medical Clinic at Githurai 44. So today I want to discuss about the diabetes. Diabetes is a disease of pancreas, which is an organ behind your stomach. So normally, pancreas produces insulin into your blood. When you eat or drink, much of your food is broken down into sugars called glucose that provides the energy to your body, which is needed by your body to do the activities. Insulin is the helper or the key to the glucose in the body. When a person is diagnosed to be a diabetic, it means the pancreas does not produce enough insulin or produces much of insulin that the body doesn't make good use of it. That is called insulin resistant. Without insulin, the glucose cannot get into the body to be used. It stays to the blood. It stays in the blood, called high blood pressure or hypoglycemia. If that happens, you may need to be injected the insulin through injection or the shot. So when you come to what causes the diabetes, what causes diabetes is the too much of sugars circulating into the bloodstream, into your bloodstream. That is what causes. Now when I go through the symptoms, the signs and symptoms, why you should be alerted or you go to your clinic, that is the increase. First symptoms, you will be having thirst, the increase of thirst and dry mouth, frequent urination. The third, fatigue. Fourth, blind vision. And fifth is unexplained weight loss. 6, we have slow healing of wounds or bed sores. And 7, we have numbness. 8, also we have frequent skin infection or vaginal yeast infection. Another thing, how can you manage this patient of diabetes? This patient can be managed through checking. Patient can manage through checking your blood pressures regularly. That is first management. Second management is take your medication. Third management, eating healthily, eating healthy food, that is diet. Be physically fit or physical active. And fourth, loss of weight. Fifth, avoid excessive alcohol. And Another one is to quit smoking. Another management is to keep in touch with your doctor or health officer. Another one, you get enough sleep. Then there is also another management which is very difficult, which is the limit, lower or limit your stress. So up to there, you have any question?
Maybe on causes, you said too much sugar. When you talk of too much sugar, which are these kind of sugar that it's too much to the body? Which sugar should I avoid?
Sugars, when you take food, there is those like white bread, they carry sugars. Do you know your body, it needs that sugar, yes. But when I say you avoid too much sugar, it means you avoid the sugary things, sugary food, sugary, which we'll talk about those foods that should be avoided. Yeah, it's just combined, you avoid too much taking of sugars. Like morning you take white bread, lunch you take white ugali, supper you take fruits or what again. That is the too much of sugars. Yeah.
The other thing maybe it's when you say what causes, the causes. Do what I eat, do it matter? Because sometimes maybe I'm taking too much ugali every day, it's ugali and maybe rice. Can that one affect?
Yes, it can affect your blood sugars because your body, the pancreas, produces the insulin. Back there I said, when your body, even the pancreas, reproduces the insulin, but is not enough to your body, it means the sugar will be too much into your body. When the sugars is too much into your bloodstream, that is called the high blood pressure. That is when you go to facility, you will be tested, you will be found you have high blood pressure. That is also another thing different. Apart from diabetes is excessive sugars into your body. Then when you take this too much of sugars, it stays into your bloodstream because the insulin will not be enough. The insulin produces with the pancreas, by the pancreas, will not be enough to mix with these sugars that produced by the food. Yeah.
When you say of that is one symptoms.
Yeah.
How can you know that? Maybe I take a jar of water in a day.
Yeah.
How should I know that I'm taking too much of maybe like water to know that that's a symptom?
So when you take sugars, when too much sugars is in your bloodstream, first thing you will start, your mouth become dry, your lips, then you will be thirsty. Each and every time you need water. When you go to your health provider, first thing you say that you are thirsty each and every time. He will test you, your sugars, your sugar levels. You will find your sugar levels is low, which means you will need to be given like insulin, you'll be injected insulin, so that at least the insulin will dilute the excessive sugars into your body so that you will become at least well.
Do diabetes have maybe you can say it's too much prone to women than to men, or it goes in both gender?
It goes in both genders. It doesn't, but mostly we consider women, because women like sugary things like sweets, dizzy. Most of the women, because there, as I say, there is also frequent vaginal yeast infection. What does that bring? It brings this excessive sugars, vaginal yeast infections. Each and every time you see the women going to the clinic have infection. What brings that infection? excessive sugars.
Sometimes maybe I can ask on behalf of ladies, when they are having those vaginal infections, some will say it's because of the soap they are using, some will say it's because of maybe the pad they are using. How can you know that it's diabetic that is causing these infection?
So that one, you will do the screening. You have treated this lady UTI, you have treated her this syphilis, STIs, but the infection is still not responding to medication. So you screen. After screening is when you find this person, this lady is suffering under vaginal yeast infection. Yeast infection is something that can be seen only through the scanning. Yeah.
And when you talk of vaginal infection, will that affect man during the intercourse?
Yes, it affects. It brings the lacerations to the lady. Lady will be feeling pain while doing well on intercourse. Then the man will also have the lacerations on the dick. Yeah.
But that one, it's not something that is transferable, that I'll get the infection from her to myself.
That one, what you will get will be candidiasis or the STIs. Yeah, to the men.
Yeah. How many times do a normal person is supposed to urinate in a day, so that I can know I'm urinating too much, so that to give myself an alarm to be checked for diabetes?
So a normal person without diabetes or diagnosed diabetes should urinate at least 3 times in 24 hours. Yeah. But when you urinate, like, you should take much water, excessive water, at least to dilute, to wash your bladders and clean your kidneys. So as the excess glucose into your body, which is the sugars, when you take that water, it will dilute that glucose into your body. Then you will urinate frequently. And as you urinate frequently, you also avoid diseases like infections, UTIs, because you will be cleaning your bloodstream. It will be cleaning all the kidneys and livers. Yeah.
You said about wound won't take too much time to heal.
Yeah, there now you find a patient or a person coming into the clinic with the same wound. This wound, you have treated this person like 3 months, no change. So what should come to your mind first? As patients get ill, you ask, for how long have you been with this wound? If it is more than 1 week, first thing you check the blood sugars, which is, if it is between 3 to 7, then that is okay. But when it is above 7 or below 3, then you start changing medication treatment or changing the management of that healing, of the wound healing. Yeah, so when you have excessive sugars in your body or glucose, the wound will not heal quickly, because those sugars, they'll be coming, you will see that wound is ever wet. That wound is ever wet, and once it's wet, even if you put medication, no healing. Yeah. So you keep on repeating yourself from the treatment.
You as a doctor, how can you advise a person? Should we come for the last question for today? Maybe you can tell us what happens for a diabetic mother who is breastfeeding.
A diabetic mother?
Yes.
Who is breastfeeding?
Yes.
What happened to
the baby now? The baby, will he or she be affected?
No, the baby will not be affected.
Oh.
Yeah. Only the mother should try to take medication or be given the insulin, yeah, so that to balance that glucose in the body. It's either she will be having excess glucose or less glucose. Yeah, so that woman should be checking her sugars frequently and getting in touch with the doctor.